So, hello everyone. My name is Mohamed Almahal. I'm the Humanitarian Response Crisis Team in Sudanese American Medical Association. Today I'll be presenting our bi-weekly update of the SAMA work during the Sudan crisis. So, Sudan Urgent Humanitarian Relief Consortium. This is a collaboration of multiple organizations working together to perform the humanitarian action in Sudan. So, regarding the outlines of the session, I'm going to talk about the humanitarian actions in 4 states in Sudan, including 6 cities: Kosti, Dongola, Rufaa, Wad Madani, Port Sudan, and Khartoum. So regarding the consortium is geographically based. Every area in Sudan has a collection of organizations that working together to perform the action. This consortium allows us to share information, share resources, apply jointly for grants, and then co-funding of projects and co-branding. The goal of the consortium is to alleviate the hardship faced by internally displaced persons moving from conflict-affected areas to safer zones. This is done primarily by leveraging local expertise and working through a local organization, what we call localization. So the scope of work is IDP support in terms of IDP's sheltering, IDP's food assistance, and IDP's direct patient support. And the other scope that we're working in is supporting healthcare services, mainly in terms of covering staff salaries. So this map marks our action areas. As I've said, we're working now in five states: White Nile, Khartoum State, Northern State, Red Sea State, and Jazeera State. And we perform maybe similar but different actions in each state. So in White Nile State, we are targeting Kosti, the largest city there. Our main focus is IDP sheltering and IDP feeding. In Khartoum, we are targeting the healthcare services, supporting the healthcare services in terms of trauma surgeries, pediatric healthcare services, obstetric healthcare services, and supporting cancer patients. In Dongola, in Northern State, we're mainly concerned about IDP healthcare and supporting internally displaced patients. In Red Sea State, Port Sudan, we established our new head office there, and our Sudan director and operation manager have been relocated there. In terms of our action there, we're mainly concerned about rehabilitation of hospitals for trauma care and dialysis care. In the Jazeera State, we're working mainly in 2 cities, with Madani City and Rufaa City. In Madani, we're working in the feeding of children with cancer, and in Rufaa, we're working in IDP support again in terms of sheltering, feeding, and healthcare. So the first city is Kosti. Kosti lies in the White Nile, and maybe it's considered the second city in terms of the numbers of IDP. Till the recent our recent statistics, there are 12 IDPs sheltered there, and accounting for more than 1,500 IDPs. Those are the IDP shelters broken down by the IDP numbers. And we are partnering there with all various organizations which help us in supporting IDP. The IDP relief project there, there are 4 scope: IDP feeding in terms of regular meals to the IDPs, which have a cost of more than $8,000 per month. And then special meals, this is delivered to pregnant and lactating women, which account for more than $4,000 per month. And then IDP shelters maintenance in terms of cleaning, sewage draining, and other maintenance actions. This is account for more than $1,500 per month. And the third thing is supporting internally displaced children. This is account for more than $5,300 per month. And then provision of psychological support, which we think important. This is done for IDPs at risk, and this is account for more than $500 per month. So the total budget needed for this month from the 10th of June to 10th of July is $16,827.25 per month. The fund released till now is $4,326.93, and the remaining budget for the period is $12,500. Regarding Dongola, as I've said, we're mainly concerned with IDP health. The IDP shelters there are 3 IDP shelters: Al-Muallim Hotel Shelter, Al-Zahra Dormitory Shelter, and Faculty of Economics Dormitory Shelter. Those 3 shelters accommodate 500 IDPs, and there are more IDPs accounting for 45,000 internally displaced persons lie outside the shelters. In terms of IDP health, we are mainly supporting internally displaced patients directly, and this is an example of SAMA direct intervention and implementation of a project. This covering the cost of the doctor visit, laboratory investigations, and medications. The total budget per month is $6,728 per month. Another project, we are in Dongola, we are partnering with Al-Hawadith Street organization, where we support patients in need. We are paying for the cost of medications with a total budget of $769 per month. In Rufa'a, our main concern is IDPs, shelter, and feeding. We are partnering with 4 organizations: Youth Recovery Creative Organization, Sadaqat USA, Rusul, and GRO organizations. And regarding the IDP shelter there are 6 IDP shelters till our recent statistics, and accommodating 1,992 IDPs. So regarding the IDP feeding, those are part of the pictures of our partners there feeding the IDPs. The target budget is more than $45,000 per month, and the total fund raised till now is $15,682. In Wad Madani, the second city in the Jazeera, we're partnering with Kulluna Qiyam. We're all various organization, and Sudan Children's Cancer Organization. Our project there is feeding children with cancer. There are 70 children with cancer that we are targeting, and the target fund is $277 per 1 child per month, and this is summed into more than $19,000 per month. Until now, we raised $10,609 per month. Also in Medani, we're partnering with Al-Hawadith Street organization. We're supporting also patients in need and covering the cost of medications with a budget of $2,692 per month. Then recently, we've established our Port Sudan, our headquarter in Port Sudan. We established our office there with Abdel Majid and Safa. So we are going to run our actions from Port Sudan. Those are some picture of the place. So regarding Khartoum, we are partnering with two organizations, Sudan Association of Pediatricians and the Obstetric and Gynecological Society of Sudan. Our action there have main four scopes: trauma surgeries, pediatric healthcare services, obstetric healthcare services, and oncology services. We've been supporting Humanitarian Hospital, or Ali Abdel Fattah Hospital, the previous name, since the 4th of May 2023. We've been supporting the pediatric department to perform the pediatric healthcare services. Our main support there is covering the medical staff payments. We are covering 7 medical staff with a target budget of $7,500 per month. Those are some of the statistics that we collected. Till now, we've been funding the hospital in 3 weeks, 3 rounds of funds, and then the total number of children attending the emergency department in the 3 weeks is 287 children, and then the average of children per day is 13.6, and the number of children admitted during the 3 weeks is 190, with an average of 9 children per day admitted in the ward. The other hospital that we've been funding is the Jazeera Hospital. We've been funding the obstetric healthcare services, also paying and covering the medical staff salaries with a target budget of $13,461 per month. With till now, we've released $4,807 per month. So we started funding the Jazeera Hospital 13th May for 1 week till 19th of May, but they've been facing connectivity issues and some communication issues, so they will not be able to continue the reporting process, and this is a problem that we've been facing with many of our partners, but I think they are doing their best to report. So the average of patients attending the hospital per day is 78.5. The average of vaginal deliveries per day is 17.7, and the average of cesarean sections per day is 10.2, and average of gynecological operations per day is 8.4. Those statistics are during this time period. The third hospital in Khartoum is Al Fuad Hospital. We've been supporting trauma surgeries of the war victims. This is done mainly by covering unpaid patient bills. Target budget is $55 $447. Until now, we've raised $500. The last hospital there is Al Hospital. We've received a request from Al Hospital to support patients with cancer through covering the chemotherapeutic medications bills and covering the oncology staff salaries. The target budget for the request is $5,000. So thank you. This is all.